Miss Nadira? Miss Nadira?
Hi, doctor.
Oh, hi.
My doctor friend gave this to me and referred me to you.
Yes, he mentioned you to us.
Yeah, doctor. Actually, I'm looking for PBM treatment so that I can be prepared for my surgery and recover well.
Well, you've come to the right place. We have a patient blood management or PBM program here, and we will definitely prepare you well for your surgery. Do you have a medical report?
Oh, yes.
Thank you.
Doctor, I feel tired very often and I was told that my hemoglobin is very low.
That means you are anemic.
Anemia occurs when a patient has low hemoglobin level. Anemia generally results from blood loss, decreased red blood cell production, poor red blood cell maturation, and increased red blood cell destruction. Now, let's see what would happen to the patient.
Why am I anemic, doctor? And I was told that my hemoglobin level was 6. Is that considered very low?
Yes, that is extremely low, Nadira. According to your medical report, you have heavy and prolonged menstrual bleeding. When you lose blood, you also lose iron. So this can lead to iron deficiency, which is actually the major cause of anemia.
Is iron deficiency anemia common?
So is iron deficiency anemia common? Yes, it is. Do you know that around 2 billion people in the world are anemic? Those at risk of iron deficiency anemia are children due to poor dietary intake of iron, adolescent girls due to menstruation, pregnant women due to increased needs of iron, vegans and vegetarians due to inadequate intake of iron-rich food, and patients with chronic disease due to poor absorption of iron. The symptoms of iron deficiency anemia are: patient is easily fatigued, patient has hair loss, patient catches flu easily, patient loves eating ice, patient experiences headaches, inability to concentrate and think, and depression. That's why the patient feels tired very often. Now, let us see how the doctor would help the patient.
Yes, iron deficiency is common.
I see. So is there a test that I can confirm I have iron deficiency?
Yes, your friend who referred you has done an iron profile study on a sample of your blood.
Iron profile study consists of looking at ferritin level, serum iron, and total iron binding capacity. Transferrin saturation is calculated from serum iron and TIBC. Iron deficiency is defined by looking at ferritin level, transferrin saturation level, and C-reactive protein level.
Let's see, here are the results from your medical report. It says you have a ferritin level of 15. That means you have severe iron deficiency, Nadira.
Alamak. So how do you treat iron deficiency, doctor?
Don't worry, there are a number of ways to treat iron deficiency. We can treat iron deficiency with oral iron. There are a number of forms of oral iron. The first is tablets, for example, ferrous sulfate and ferrous fumarate. There are also chewable tablets, for example, iron polymaltose, and there is a syrup form, for example, iron polymaltose. There are drawbacks about oral iron, however. It may cause stomach discomfort, constipation, and oral iron is also poorly absorbed. And it's important to point out that multivitamins have less iron content. The alternative to oral iron is intravenous iron, for example, iron sucrose, ferric deoxymaltose, and ferric carboxymaltose. But the drawbacks of intravenous iron are that it needs to be given intravenously, and there may be pain at the injection site or rash and transient facial flushing, which resolves spontaneously. It is also important that you include iron-rich foods in your diet. There are meat sources of iron and certain vegetables, fruits, seafoods. Let us calculate how much iron you will need. Your hemoglobin level is 6 and ferritin level is 15. Your weight is 80 kilograms, and for an adult weighing 35 kilograms and above, the normal iron stores would be 500 milligrams.
So when should I get the IV iron treatment, doctor?
Well, as soon as possible, Nadira, but we also need to stop the heavy menstrual bleeding. Otherwise, we'll have to give you more IV iron.
My gynecologist has given me some hormonal therapy which has stopped my menses, and I am scheduled for my fibroid removal in 4 weeks' time. That's why I want to be prepared.
That's good. Let me arrange the IV iron for you then. It can be given as an IV slow bolus or as an infusion, but I prefer to give it as an infusion. So I will arrange for 1 gram of IV iron infusion to be given first, followed by a repeat dose in a week's time.
How long will it take for my hemoglobin level to increase?
Well, the hemoglobin levels should respond within 3 to 5 days, and depending on the level of iron deficiency, the hemoglobin levels should normalize by 2 to 3 weeks. Don't worry, Nadira. IV iron therapy is very safe. It only takes 30 minutes, and you will feel slight pain at the injection site. Some people may feel warmth in their body, but some people have no reactions at all. So many people have actually taken this therapy and they feel more energetic afterwards. So IV iron therapy is simple, safe, and effective.
Okay, doctor, I'm ready. Let's do it.
Great. Let me arrange it for you then.
I'm glad that the doctor gave the patient IV iron infusion treatment. This is the most efficient way to increase patients' hemoglobin level. I know many patients are afraid of infusion. It is a little bit painful when injecting, but you will feel more energetic later and also think better.
Nadira, I'm pleased to tell you your hemoglobin level has increased to 13. Now you are safe for surgery.
So I don't have to do blood transfusion for my surgery, right?
That's right.
This is awesome. I don't need blood transfusion after all. This is my own blood.